Hey there, welcome back to HFS Health. Today, we're diving into a crucial topic that affects many women, womb cancer, also known as uterine or endometrial cancer. So, grab a cup of tea and get ready to learn everything you need to know about this condition. Before we begin, please remember that while I am a registered doctor in the UK, let's start by understanding the basics. Your uterus, or womb, is where a baby grows during pregnancy. Womb cancer typically originates in the lining of the uterus, also called the endometrium. The seriousness of this cancer depends on factors such as its size, spread, and your overall health. Throughout this video, we'll discuss the causes of SPATcher. Now, let's delve into the potential causes of womb cancer. One major factor is having high levels of estrogen, especially if you're overweight. Additional risk factors include diabetes, a family history of bowel dilatation. Moving on to symptoms, it's crucial to know what to look out for. The main signs of womb cancer include postmenopausal vaginal bleeding or spotting, unusually heavy periods. Remember, experiencing these symptoms does not necessarily mean you have womb cancer. Now let's talk about what happens when you visit your doctor or healthcare provider. They will ask about your medical history, family history of cancer or Lynch syndrome, and details about your symptoms. A physical examination might be necessary, which involves undressing from the waist down, and the doctor using their fingers to feel for any abnormalities in your uterus and cervix. It's completely normal to feel anxious or embarrassed, but please know that healthcare professionals are here to support you and answer any questions you may have. You can even request a female doctor or have a trusted person present during the examination as a chaperone. If your doctor suspects further investigation is needed, they may refer you to a specialist who will conduct additional tests. These tests could include a transvaginal ultrasound scan to examine your uterus, a biopsy to remove cells from the uterine lining for analysis. The waiting period for test results can be nerve-wracking, but remember that delays do not necessarily indicate a problem. If you're concerned, feel free to reach out to your healthcare provider for updates. Once the test results are in, a specialist will explain the findings and discuss the next steps with you. In the case of a womb cancer diagnosis, further tests such as CT scans, treatment options, which may include surgery, chemotherapy, radiotherapy, or a combination, will be tailored to your individual circumstances. Your healthcare team will guide you through the treatment process, including managing potential side effects. I've included additional resources in the video's description for further information on treatments, investigations. Before we wrap up, I have 3 requests for you if you found this video helpful. Lastly, feel free to leave any questions or comments in the comment section below. I love hearing from our viewers. Thank you for joining us today on HF